is this something I just have to live with for the rest of my life, where I just have to get good at ignoring it? Or are there things I can do about my tinnitus?
So all three. So it's a really, really big subject. So after the diagnostic test, there's basically a few different branches involving treatment. And so really it comes down to trial, what's going to work for that patient. And the bottom line is that it's pretty unusual, even though not impossible, but it's pretty unusual for the tinnitus to just go away completely and never have to rear its ugly head again. So for a lot of people, it just comes down to getting substantial relief. And that relief can come from a lot of different kind of avenues or different branches of that treatment trial, or what we allude to as the treatment trial. So it can come from devices, which can be like maskers. So there's quite a few different apps out on the market that are really good for tinnitus. There's a few like masking devices that are used. Some patients get relief from them, but the apps are usually the go-to when we're trying to reintroduce sound to the system, in addition to hearing aids or hearing devices if there is a loss, changes in diet and medications, sometimes surgery, depending on the cause or the etiology. So what we usually tell patients out the gate is really to not obsess about the tinnitus. You're really trying to help your brain habituate. So finding the right professionals to navigate and drive the diagnostic piece for you is going to be really important. Because when you start obsessing about it and trying to Google it and find different causes and support groups, it generally tends to make it more persistent and worse, which is what we're trying to avoid. So, the juxtaposition is really you're trying to find a solution, but the solution or the hunt for the solution can actually be causing more of a sense of awareness and aggravating the system with regard to, your heightened sense of awareness. So a lot of times people just get used to the tinnitus. They learn to just tune it out, which really comes down to a lot of habituation. And when it doesn't happen, or the patient's not habituating with a lot of the treatment options that they have kind of worked through with their professional, it can really start to alter your emotional state. And so when patients aren't sleeping, they're having difficulty just overall with the anxiety that can be associated with it. A lot of times, working with your physician where you can, kind of work through a medical management plan will allow patients to get the relief they need and a full night's sleep. Because sometimes tinnitus can start to actually creep into a lot of sleeping patterns. So the long and short is we do kind of work through a very kind of systematic process. There's a lot of different branches to what that process looks like. But a lot of patients do get significant reduction and kind of move through it.
And it sounds like you don't want to play Dr. Google.
Don't play Dr. Google. Yeah. I mean, there's some really good websites. So I think one of the biggest things for a lot of patients is getting onto the appropriate website, as opposed to just kind of throwing stuff, at the wall and seeing what sticks. There's some really good tinnitus websites. So let me see, I'll pull up some good ones because I'll give you some references. But let me pull up real quick here. And so one of the best ones, we could actually put a link on our website too. The American Tinnitus Association has a lot of really good tangible resources. So that's always a good one. And each area typically has a local chapter. So that'll kind of clean up a lot of the craziness that can be out there when you start kind of looking to Dr. Google for resources.